All right, well, thanks for giving me the opportunity to lecture in front of you for the introduction portion of orthopedic acupuncture. They're all being very nice. What I want to first talk about is sort of a general review of what integrative orthopedic acupuncture is. And here are three of the objectives I want to cover in the next 10 minutes or so. I want to identify the differences between IOA, integrative orthopedic acupuncture, and traditional Chinese medicine. I want to then summarize the 6 components of IOA, integrative orthopedic acupuncture, so that you can actually start to think about how do these components fit into an actual practice of the work. And so when you get to clinic, that'll hopefully be a chance for you to do that. Explain what makes IOA integrative, why is it integrative, and hopefully we'll be able to flesh that out as we go. So, So integrative orthopedic acupuncture, or orthopedic acupuncture in general, has always been sort of practiced side by side with allopathic medicine. Allopathic medicine being traditional Western medicine. Even in China, when you go to China and you want medical care, the hospital is divided up between Western and Eastern medicine. Some hospitals are starting to integrate where you'll get care from both sort of medicine providers, but for the most part it tends to stay in separate silos, and that's some of what we see in the United States, and especially in the Boston area. So hopefully with time and our new affiliation with the university, we're going to see these two sort of come together, and there'll be overlap between the two medicines. So where as an acupuncturist you'll be able to practice, communicate effectively, and apply techniques that both Western practitioners and of course Eastern practitioners will understand. And that's where the magic will happen. And those are fireworks, not explosions. So we understand traditional Chinese medicine as being, for the most part, composed of these 5 pillars. Acupuncture and herbal medicine being the 2 components that you study the most in school. Tai Chi and Qigong, which is a movement therapy, dietary therapy according to Chinese medicine principles, and then Tui Na, which is a bodywork therapy. So there's more than just Tui Na, there's Shiatsu, there's other forms of traditional Chinese bodywork therapies. And these all are based on Chinese medicine principles and philosophies and theory. If we look at orthopedic acupuncture, however, or integrative orthopedic acupuncture, what we'll see is that it comprises of 6 different components. The component that's going to stand out to you that you may not be able to relate to what we know in terms of the 5 pillars of Chinese medicine would be the orthopedic physical assessment part. And in acupuncture we have diagnostic skills or measurement techniques where we look at pulse and tongue. The orthopedic physical assessment deserves its own category when we look at integrative orthopedic acupuncture. So I'm going to talk about each one of these and how they relate and how they differ from what we understand in the 5 pillars of Chinese medicine. Oops. So the first one is orthopedic acupuncture. This is the practice of this medicine that we'll be practicing in a little bit, which are the principles of TCM acupuncture and meridian-based therapy folded into what we already know of from an allopathic perspective on tissue physiology and pathology. So we're looking at applying this integrative method to both sort of anatomical structural types of work as well as meridian-based or TCM theory work. We also will be needling structure specifically as it relates to the anatomy as opposed to the energetics or the positions of the acupuncture points as we know them. We also want to incorporate a little bit of evidence-based information into this. And this will be a common theme that you'll keep seeing with integrative orthopedic acupuncture, is that as you apply it, there should be some supporting evidence as to why you would do that kind of work. For instance, we've been applying innervation zone needling, and that's based on some research out of the Netherlands to locate these specific points that can be very effective for improving muscle function. So that's the orthopedic acupuncture side. The next one is Dida, or herbal medicine, that we don't get a chance to really dive into. Those of you who are practicing or studying Chinese herbal medicine, you might cover a little bit of this, but for the most part this is either internal or external application of herbal medicine, either in the form of plasters, mashed up herbs, or soaks, that you soak a towel or you soak some other thing to put on the area of injury, and this will help with pain control and overall tissue healing rates. But for the most part, within this integrative, these 6 pillars of integrative orthopedic acupuncture, we're going to be really relying on the Chinese medicine side of things, the Chinese medicine theory side of things. Now, we do know that things like comfrey or yarrow, how many people here have heard of those things before? Yeah, have you used them before in practice? Yeah, so these are very good for like bone knit is comfrey. Yao is good for bleeding disorders. And so that has been shown through research to be effective to treat certain kinds of conditions. And so we can apply that information as we also apply Chinese herbal medicine. And once again, we have the evidence-based piece to back that up. The next is Tuina, or manual therapy. And this could encompass certainly what we know in terms of meridian-based therapy. We're applying manual therapy techniques to meridians and different areas of the body, but we're also doing them to improve joint mobilization or mobility, muscle function, and to decrease pain. So we sometimes talk about joint mobilization, where we're able to move the joint itself to create some stretch to allow for greater joint mobility. We can do things where if muscles are exceptionally shortened, we can do techniques like muscle energy and other types of things to sort of open that up. So we can take what we know in terms of the meridian system and the acupuncture points and how to apply Tuina, and we can use things like the anatomy trains, the physical structure of the body, and to use sort of tried and true manual therapy techniques to treat those. The next one is movement therapy. So this would fall under the category of like Qigong and Tai Chi, where you're doing an energy-based movement therapy. And when I talk about it in this respect, certainly those things can be very helpful. Tai Chi has been shown to be very effective for people who are at fall risk. They're good for patients with dementia, or the onset of dementia. And so there's lots of studies to support that by Peter Wayne over at Osher Center. But there's also certainly a lot of information there about corrective exercise. Things that you can learn after school, or hopefully pick up a little bit in the course, where you'll get to know if I apply this kind of, or help a patient understand how to apply this kind of technique or exercise, that'll improve the condition. And that'll be derived through the physical assessment and understanding the body from a physical or structural perspective. This is also going to be important when to refer. So if we have a patient that we can identify as needing physical therapy, then we want to be able to say, okay, well, our job would be to control the pain of this particular case, especially if it's chronic, and then you would then refer the patient to a physical therapist to, so to get the sort of advanced kinds of corrective exercises that they might need. How does that sound so far? So far, so good? The next one is adjunctive therapies, and this is going to be pretty much what you already know. So we apply in Chinese medicine cupping therapies, gua sha, which are scraping therapies, moxibustion. These are all the same things that we're going to apply in an integrative orthopedic acupuncture setting. But we can go the step further or extend our amount of adjunctive therapies by doing things like kinesiology taping or grass antique. And there are a host of other types of therapies out there that have some evidence to support their use for musculoskeletal pain and dysfunction or orthopedic types of pain. But others that may not necessarily have the evidence to support it, but have been used and seem to be effective among certain populations of people or types of pain. And so once again, we're going to have this common theme of evidence-based information or medicine that's going to sort of always ring through everything we try to do as much as we can. And the last would be orthopedic physical assessment. So this is the sixth pillar of the integrative orthopedic acupuncture approach. And we need to use assessment tools to identify the tissues and structures that are possibly pathological or producing pain. When we can do that, then we can apply the integrative orthopedic acupuncture to the structures that are involved, to the the tendons that are injured, to the cartilage that's being affected, but also understand it from the perspective that we can still apply the energetics of our acupuncture points. We can still do the Tuina that we know, the dietary therapy, all those kinds of things. That's the only thing that's missing from this sort of wheel right now is the dietary piece, because it would just make the wheel kind of unruly if you had 7 things in this wheel. But that's another piece of it too. So what is IOA integrative? Well, we are including different principles here. So we're going to never lose the richness of our medicine, which is traditional Chinese medicine. Without that as the foundation, just treating the structure of the body, just treating the soft tissue and the pathology really won't be enough. Chinese medicine is rich in terms of how effective it can be. And that's also very much evidence-based. And so we have a lot more evidence, especially when it comes to the treatment of pain, than we ever have before. And so even in some cases, better than what is currently being applied in hospitals. And we can go into that at some other point. But when you understand how to apply this kind of medicine, you also will get some of the terms and information to be able to translate what you do to a Western healthcare provider. So they don't necessarily want to hear about the chi and the blood and the things that we know to be able to understand how a person is experiencing pain. They need to understand it from a biomedical perspective. And so hopefully at the end of this class, you'll be able to understand that too. And we utilize acupuncture points that have multiple purposes. So we know that some acupuncture points are great for neck pain because that's what it was traditionally used for. But we're going to overlay that into knowing that the point is also good because it's a trigger point or some other type of point that can be very effective to the muscular structure of the body. And like I said, all of it is going to be evidence-based. So just to review the directives that we tried to accomplish in this very short introduction, being able to identify the differences between the two medicines is important. We have one that's more of a biomedical model, and the other one is the traditional Chinese medicine model. But we hopefully can see that there can be overlap between the two. Hopefully we've effectively summarized the 6 components of IOA and explained what makes IOA integrative. So one last thing I want to leave you with is that, I know that some of you have already done the needling, but it doesn't have to be a very strong needle technique or approach. That's something, if you're going to do orthopedic kinds of conditions, you have to needle very deeply and strongly in order to create an effect. So for the most part, it can be a very gentle technique. You're always working within the parameters of what your patient can accept or is willing to take in some ways. So do we have any questions before we finish? All right, well, thank you. That was it. Thank you.